Priority Consult has been with our program since the beginning. So we've always used Priority Consult for collection of outcome data. So we knew nothing else. It's always been a part of our program. We've used our outcome data actually we've used it already to go out to insurance companies and payers to prove the efficacy of what we're doing in our spine program. We've gone out also to different workers' comp companies, and we're going out to different employers to say that our program has the results that we're going out and telling the employers that we actually have. So we've been very successful, I feel, in using our outcome data with the private insurers, with the payers, to prove the effectiveness of our program. We've used our clinical outcome data with our surgeons to actually compare surgeon to surgeon. Somewhat controversial at first, but we always said we had transparency between our program. So we have actually used some of the data with the surgeons to begin to look at best practices with the individual surgeons. I'll give you an example. We had one surgeon who was doing multi-level fusions, and his outcomes were not as good as his partners who were doing 1- and 2-level fusions. So we've been the docs at first were a little leery about it, but now they've actually begun to embrace the outcomes to see what doctor is doing what, and actually becoming, I don't want to say that it's a program that everyone's doing the same thing. However, they're beginning to look at what's the best practices based on the outcomes. So it's been a very super tool for us to be able to look at comparison between physicians.
Before we were using another process where it really fell into the place of our physicians' offices to collect the data, and it was not consistent. We really didn't get any usable data or meaningful data from that process. This has really pulled all the data into one software program. It's very nice because they can send web links out to our patients, so our patients can just fill it in online. And we have a process in place where if that is not available for our patients, we do mail them the surveys, and when we get them back, it's very easy to enter it right into Priority Consult and have all that data there. Our next marketing launch that we plan on doing is sharing our outcomes data. And we are going to use some of our functional data, but also on the inpatient side we'll use our surgical site infections, our readmission rates. Our data overall our outcomes overall is very good, so we are going to use that for marketing purposes.